obviously this whole thing is the kidney. Better get that one right. Oh, it's going on YouTube now. I'm yelling at you to get things right. This is the, don't delete that part, urinary bladder. These are the ureters, okay? This is the urethra, okay? I reserve the right to whip out the reproduction model and point to urethra. Yes? Sure. Why not? Okay? Yes. Okay? Now, this is my other trick that I'm going to, let's throw it out there because I'm going to show you the juxtaglomerular cells and explain what they do. Okay? This is afferent arterial, glomerulus, the red spaghetti, Bowman's capsule, efferent arterial, leaving. What's this? Proximal tubule, okay? So could I ask that?
Yeah.
Absolutely, yes, okay? Proximal tubule is right there, boom, and you can even see the microvilli, which I'm going to add as an option next year, I think. Microvilli of the proximal tubule, sure. Everybody sees this, it looks like a bacteria stuck to the artery. Okay, everybody sees that? Those are called juxtaglomerular cells, okay? Juxta means what? Next to, okay? The glomerulus. What the juxtaglomerular cells do is monitor the fluid pressure moving through the afferent arterial. If the fluid pressure drops, okay, of the what that's moving through the afferent arterial, the juxtaglomerular cells can detect that change in pressure and will release a hormone called renin. Renin helps you to retain fluid. So if your blood pressure goes down, these cells will help work to bring it back up to normal, okay? Juxtaglomerular cell, right next to the glomerulus. What they are is basically pressure monitors. They're monitoring what blood pressure is moving through the afferent arterial, okay? This fluid pressure going into the afferent arterial and push through the glomerulus is higher than that of systemic circulation, much higher, okay? However, when you hit the peritubular capillaries, that's a traditional capillary bed just like anywhere else. That pressure is low, okay? So the afferent arterial pressure into the glomerulus is high. But the peritubular capillaries, the pressure is just like any other capillary bed. It's low and slow, okay, so that you don't rupture them. Okay? We feel happy about the kidney? Okay. Now I can ask you, what's that? You tell me. You just told me you're happy.
Yeah.
What's the tip? Renal pelvis, ureter, renal calyx, and we see that that's not easy to spell. Yeah. The outer rim is the cortex, the intersections, the medulla. What's the space in between the pyramid? Renal column. Okay. The red one's the renal artery, renal vein. Okay. Urinary bladder. Yes. Urethra. Ureter. Okay. Now on this, on the one that's a flat panel, one of the sides it has a little screw in it. You can take the kidney apart to see pretty much everything. Okay. You can see renal pyramid, renal papilla, renal cortex, medulla. You can see pretty much, you can see the renal pelvis, the ureter. Okay. What's this on this side? What's this thing? Gonadal artery and vein. Okay. What's this? These two? Common iliac artery. This is the left common iliac, right common iliac. What's the blue one? Inferior vena cava, descending aorta. Okay? Superior mesenteric artery, inferior mesenteric artery. Okay? Oh yes, and now we have internal iliac artery, external iliac artery. This is on the left, right. Okay? This one I can ask also, suprarenal artery going into the adrenal gland. You can ask renal artery and vein, absolutely. Okay? Good? Good. Do we ask
No.
this bone marking?
No.
No, we do not? Okay. We're voting, but we know it, right?
Yeah.
And what's this thing right here at the back? That would be behind the,
Bladder?
behind the bladder. The rectum, shout it out, we know the right answer, that would be the rectum. Can't forget that one, okay? So if it's sitting like that, and there's the rectum back there. Okay? Okay. We feel good? It's not, this one, there's not really that many IDs for the urinary system, it's not too horrible, okay? Now, you won't be asked any function for the practical, so I will not point to this tube and say, what is it permeable to, water or salt, okay? But for the quiz, yes, fair. This side is permeable to water. This side's permeable to sodium. This side's working, you get concentrated urine. This side's working, you get more dilute urine, okay? What is the purpose of all this? To prevent dehydration, basically. Okay? Good? Yes. Okay. Now, we're going to do a dissection of the kidney, okay? So, we're going to do probably, I would say you could probably look at, I probably have 12 in there, let me check, 1 or 2 per table. What you will be able to see, essentially, you take the kidney and you're going to cross-section it, okay? That's the best way to see anything. What you will see when you look at the cut open kidney is going to be something like this. You'll probably be able to make out the renal pelvis, some of the pyramids and the columns. You will not see, obviously, the nephron.